Okay. Still got people joining. Thank you, thank you, thank you. If anyone, feel free to introduce yourself in the chat. We're gonna get started in a second. Just people are still joining us. And just want to shout out our speakers today, Jason, and Kevin.
Hey y'all.
It's gonna be a really great discussion. Gonna dive into some policy stuff towards the very end, but we kind of wanted to take a different direction. I think everybody has, we don't know everybody's been really appreciative of like our policy updates, but also we know just in this political climate, policy can be overwhelming and can lead to burnout. So we kind of wanted to just switch up the tone and go in a different direction this time. But still going to plug some of our policy stuff. So we're going to drop in our a couple of action alerts that we have been having going on. We're going to drop those into the chat a little later. And Jeremiah is going to give like a very brief update. If you've ever been, I am one of those people who I will start off making two or three slides for a presentation, and before you know it, I've created a 20-page PowerPoint. So to prevent me from doing that today, I have no slides because two slides turn into 20. So we're gonna really keep this we're really gonna keep this as a round table. The only slides we are going to have, we're going to start off with a little Mentimeter poll, which is going to be fun and interactive and really just set the tone for today's conversation. So, um, if no, give people maybe one or two more minutes to join. Thank you for everyone who is already joined us for this conversation. We've had quite a few people register and share across social media. We're also live streaming on Facebook right now. So, and we will be on YouTube. We will have it uploaded to YouTube sometime next week. Okay. All right. Oh, a few more people joining. Let me queue up the Mentimeter. Anybody familiar with Mentimeter? I'm not familiar with Mentimeter. I'll go over what it is. It's basically a where you can add it to your presentations and to your webinars. Once I pull it up and share the screen, there will be a QR code that you can scan with your phone. And basically, you'll be able to answer some questions anonymously, and it'll show like the percentage of everyone who like agrees, disagrees, or answers these questions. And these questions are going to be around stigma and shame. Put yourself in the position of a provider or counselor or PrEP navigator if you're not in one of those roles when you answer these questions. So let me go ahead and share my screen. Okay, so to join the Mentee, can everybody see the screen? So to join the Mentimeter, you go to menti.com and you can add that code, or you can scan the QR code to the right of the screen and answer the first question. First question, PrEP clients should still be told to use condoms consistently. And there's no right or wrong answer. We just kind of want to gauge where people are, what people do in their practice, or if you're not in the practice, just what you agree with or disagree with, um, and see where we go from there. Okay, gonna leave this one up for about, let's say, 45 more seconds, and then we'll move to the next slide.
Michael starting us off very non-controversially, just really super easy breezy conversation.
Oh no, we have 55 more minutes. I promise I'll be controversial before the end. Just we just ask that no one throw their laptops or electronic devices across the room. Okay, so we have about 13% say strongly agree, more than half say agree, 19% say disagree, and 13% say strongly disagree. So, okay, that's where everyone is. If prep clients should be told, let's see. Uh, prep clients should still be told to use condoms consistently. Okay, next one. A new client seeking PrEP drinks heavily and uses drugs. A counselor should prioritize substance abuse counseling referrals. Strongly agree, agree, disagree, or strongly disagree.
I love the sipping the beverage while the controversial questions are up, Michael.
I should have had my teacup says verse across the front of it. So it's always funny how most people don't catch on when I'm drinking. It'll be like one person will inbox me and say, "Is that what your tea mug says? Coffee mug says?" All right, got to repeat the question again. And again, no right or wrong answers, but I do want to just highlight one key word in this statement. A new client seeking PrEP drinks heavily and uses drugs. A counselor should prioritize substance abuse counseling referrals, making it a priority. Okay. Leave it up for, seems like it stopped, so I can go ahead and go on to the next one. A testing client is a cisgender woman with multiple partners. She says PrEP is only for gay men. How do you respond? This one is open-ended. You have about 200 characters to respond. And don't think too heavily about this. Just think of like you're in a real world situation. Say what comes natural. Mm, I like that one. Asking a question, answering a question with a question. That's motive. No, but it's like kind of reminds me of like motivational interviewing. That's one of my favorite techniques. So let's take a look at some more information. I like that one too.
Growing up, whenever my father would disagree with something I would say, he would say, "Why do you say that?"
Okay.
I started to use that. That's amazing.
These are all good answers. I don't see any. I don't see any that make my jaw drop. So, and if any of these stick out, because like I said, this is a round table. So if any of these stick out, just make a mental note of them because we're definitely going to come back to this. Okay. One more, and this one is open-ended as well. Your prep client wants to leave your program because other staff at your clinic are judgmental. How do you respond? Sometimes we can be the most progressive, sex positive, um, prep counselor or provider or medical assistant, but it only takes coming across one judgmental staff person. So, and I'm speaking from experience. I will recommend another clinic and will apologize for the judgmental coworkers. Get all the info you can from the client and validate them. I like that. Stay on your prep and I will deal with the staff. That's a bold one. I love it. Do you feel comfortable with sharing your experiences with me? I love that one as well. I love that so many of these answers are client centered. They're not about just retention into a program. And I think many of us have been guilty of that. Sometimes we get very numbers focused and we have our own egos about our work. And sometimes we can forget that the reason we're here is for the client. Who said that? I'm taking names. I love that one too.
Jason used to bring back to Callen-Lorde. I think that response in particular.
Okay. Thank you all for participating in this activity. I'm going to stop sharing screen. All right. Before we jump into the roundtable, just anybody have any thoughts? You can either drop it into the chat or come off of mute and just any thoughts that you have around some of those answers. Anybody want to share their answers? Just going to take a minute or two, not a big activity. Okay. Well, without further ado, I will go.
Well,
Oh, sorry.
I will just say real quick, I think for the first two questions in particular, it mattered to me some of the words that I focused on. So I think in the first question, patients should be told to consistently or to use condoms consistently. And I read that just based on my own personal experience as a you should use condoms consistently.
Mhm.
But I could see someone else reading it as maybe told about the benefits of using condoms consistently, but without prescribing what you should do. I think that sort of tipped me one way or the other, depending on how I read
And I saw Rick's hand went up as well.
Yeah, kind of to Jeremiah's point. I keep going back to the word intentionality. Um, and you need to be we should be intentional with the words we use. We
Mhm.
shouldn't be telling people what they should be doing. What's the point of PrEP? Uh, Starting with that, is the point of PrEP that everybody should be on it? Or is the point of PrEP that here's an option that is open to you to protect yourself?
Right. And I always think it's important to interrogate our own way of saying things because especially when, some of us are in like smaller community-based environments where you can like foster um relationships a little differently than when you're in like a fast-paced clinic and you're seeing clients all day. And so sometimes your words become repetitive to the point that you're not really thinking about how people are interpreting them because you can give the same spiel every hour about prep to a new client and eight different clients are going to interpret that what you say differently. So really thinking about how you talk to people, listening, and I think that was one of the ones that really stood out to me. With the last question is that people were actually listening to a lot of responses showed that people were actually listening to what the client had to say, and the client didn't feel comfortable in that clinical environment. I think that's important to kind of listen to and understand what our client is. Okay, so we're going to jump right into the rest of the discussion. We have two Prep Users Union members with us today. Kevin Chadwin Davis, who I want to give a round of applause. He just got his MPH and he's been active with us for several years. Also, we have Jason Watler, who wrote an amazing article for Positively Aware that really was what sparked this conversation about why we wanted to have this roundtable. So, definitely want to give him his props and shout out for that. And also the amazing Jason Rosenberg, who is the newest member of Prep for All's board of directors, but definitely not new to Prep for All, has been around and a part of the Prep for All family since the inception, since we started. So these are our panelists today. Let me go ahead and just pin them so that the camera isn't jumping all over the place.
Troublemakers indeed, Jeremiah.
So, actually, my first question is for Jason Watler, and everyone else can jump in, but I just want this is definitely specific to the article that he wrote in Prep We Trust for Positively Aware. Rick, do you mind dropping that link in the chat if you have it handy?
Give me
Um,
just a second. Yeah.
Okay. Jason, you said one of the things you said in your articles is that you'll see people position themselves as educators, and you put educators in quotes, but the tone is rooted in shame and not care. How have you seen that play out as both a PrEP user and as an advocate? And what are the consequences when providers and counselors use stigma and shame?
So definitely tidbits on that so because of online, anybody can have a platform. So
Mhm.
literally people will position themselves as, educators, and it's usually like in a bad faith argument, and usually it breeds more stigma. So like I've seen posts saying like, oh, y'all are using doxypep, which is doxycycline used as post-exposure prophylaxis, in a dangerous way, and that's just going to make more STIs and everything are not supposed to be quote unquote cum dumps with that. And it's the same for PrEP. There's a lot of like PrEP shaming, oh, why you're on it because you're a quote unquote a whore, a slut, whatever, you're getting it in the back alleyways or what, stuff like that. So it's usually bringing in more shame, and usually with a lot of that shame, that's not going to get people into the clinics. That's going to drive them away from the clinic, or that's going to keep them in silos, and is really doing the opposite of that. People are going to want to experience pleasure on their own terms. So for me, like as a you know, be, as I being on both sides of it, being a PrEP user, and I've had providers that I've spent time with interrogating my sex life, um, then asking me about my sex life. They're just mostly just interrogating it, and I feel the shame and the judgment coming from that provider because of maybe their provider by their personal beliefs or provider biases. Usually I have providers that shame me. I have providers um, that told me, "I'm glad you're taking, charge of your sexual health." And the conversation became, are you still using condoms, or how many partners do you have? So it shifted the focus away from prevention and more towards policing people's behavior. In the second, as someone that's been on PrEP, and someone that has, got people linked to PrEP, the second someone feels shamed or judged, misunderstood, or any of those things, they're not going to come back to you. They're not, because there's many people that I didn't go back to because I felt that from that provider. And as an advocate and a patient navigator, I see this happen all the time. Some educators unintentionally, communicate that PrEP is acceptable if you're still trying to fit in someone else's ideals of responsibility and responsible sex, and that's not really education. That's just moral judgment disguised in public health, which is a lot of the social media posts that I see every now and then online. It's just not public health; it's moral judgment. And shame has never been an effective prevention strategy. Shame keeps people from asking questions. It keeps people from disclosing behaviors honestly. It keeps people from returning to care. It keeps people from, after they've been judged. And it's also when people anticipate criticism, instead of compassion, they avoid healthcare altogether. And our job is um, our job is to determine whether someone's sex life meets our standards. Our job is to reduce the harm, increase access, support people in making informed decisions that work for their lives and for their lives. Prevention works best when people feel respected, not when they are feel like they're on trial. And nobody doesn't want to feel like they're on trial.
Right. And it's interesting you say that because a lot of times for young gay men, I know like for a lot of women, they start engaging with the healthcare system, either with birth control or getting pap smears, at a very young age, seeing an OBGYN. But for a lot of us, our first time engaging the healthcare system is when we go to get an HIV test or when we go to get information about PrEP or linking to HIV care. So if your first time really engaging with the healthcare system is met with shame and embarrassment or feeling like you can't be truthful and honest, it's already like kind of setting a bad precedent for how to move forward with the healthcare system, both with sexual health and outside of sexual health. So,
Exactly.
Kevin or Jason, do you have anything to add to that?
I'd like to chime in really quickly. Jason, I resonated with a lot of things that you said, and it like kind of stirred up a memory in my head from when I was a young boy living in East Texas. And I'm 31 now, but when I was 16, I was, still coming out as a queer person, as a gay person, in a small town of like 5,000 people. So, I was the only one, which kind of put a huge target on my back, but also made me feel very isolated. And in those moments I really resorted to, even as a 16-year-old, I downloaded Grindr and I started participating in sex work and like just to find connection to people that were just like me. And I ran into many situations where like back in the day they would call it an HIV scare. And my first instance of that was when I was 16 years old. And I remember I was working at a Pizza Hut. Don't laugh. That was my first job ever as a young queer person. And back then, this was tw 2012. PrEP had just been approved. At the time, I had no idea that there was an HIV prevention method available. Um, but being in East Texas, even if it was available, the access to that information was very, very minimal. And so, in that instant, I had to have someone deliver an HIV test to me, and it had to be very discreet, and it was in the parking lot of a Pizza Hut. And I'll never forget how it made me feel to know that like my life could potentially be ruined from that moment. And it was my fault because I wanted to survive, and it was my fault because I needed to get out of the situation I was currently in. So, that moment is what has lit a passion inside of me. And later on, I would eventually go to move to Dallas and find my queerhood and find my groups and find my people and eventually find the education to lead me to getting on PrEP. But just the bare minimum of having the education is something that prevented me from ever starting it. And also living in a healthcare desert in Texas in the South, where stigma is people's second language, first language sometimes, I allowed a lot of that perpetuated stigma to guide my decisions as a queer adult living in Dallas, Texas, away from the country. And I continue to do my sex work. I continue to do my risky behaviors that providers would tell me that I have. And even when I started PrEP, the biggest elephant in the room was the fact that I was a sex worker, the fact that, I used drugs, and the fact that I had all these things wrong with me. All these things wrong with me, but the one thing I actually needed at the time was my protection and my autonomy. And so for me, I hear a lot of people say that moments like that dissuade people from getting on PrEP. It actually made me fight harder. Um, and it's the reason why I've stayed on PrEP for now 10 years, because not only am I protecting myself, but I have a duty to make sure my community knows that there are people out there like me and can also do their due diligence in making sure we have our autonomy. So,
I love how you say autonomy. I think that is a very important way of looking at things. And I'm actually going to rephrase my follow-up. I had a second question, but I'm going to rephrase it after we did our poll. And the overwhelming majority of people said that they would tell their clients to use that they should still use condoms consistently. Um, what has been the impact on you guys when you have been told you should do something versus versus giving options? How has that impacted you when you go into a clinic?
eye roll.
Yeah.
I'm just being honest. It's so I'm like, I'd much rather it be reframed as like, how can I help support you in your journey? Like, what are you going through right now that will that will prevent you from going on this journey with me? And like getting on prep for the first time and staying on prep. And also like even in the beginning when I first started on prep, like there was this notion that prep was free. And when it had finally come to the moment for me to do my appointment, they charged me. So it's, there's a lot of things that are perpetuated online that have have not always been true and not always been true to my experience. And when someone tells me to wear a condom and I didn't wear a condom before that appointment, um, there's little to nothing you can say or do that will make me or force me to do what you're telling me to. And also, in my opinion, and the way that I learned about prep is that it's a part of my toolbox. That's what my peers told me. That's what my friends told me. That's what my mentors told me. They were like, this is just one thing that you can have in your toolbox of healthcare. And, it's your choice. Like when someone told me that it was my choice to get on prep, that's when I felt like I had the power to do so. Not because the clinic said I needed to get on it, not because the clinic said I needed to wear condoms during every sexual interaction. No, I did it because I wanted to save my life. And I wanted to have my autonomy. And honestly, the way that people positioned the idea of getting on prep was empowering. And so I couldn't have done it without the people in my circle. And, the people in my circle had very different experiences even to me, going to the same clinic, getting on prep. My best friend, she's a Black woman. She went the next day to get on prep, and the provider told her no because she was a Black woman and she wasn't at risk. What does at risk mean? I think it's so crazy that the person that motivated me to take care of myself went the next day and was told no based off of their skin color and their gender. Um, it just goes to show like how much privilege exists even within our movements, within the people that access our healthcare system, including myself. There's so much more work to do to make sure that people that aren't accessing these medications and these programs actually have them.
No, and it's funny that's happening even with DoxyPep now, how we haven't learned from a lot of our mistakes with PrEP because I've talked to a lot of my black gay peers who have said that going into clinics where they've seen white providers, they have been more willing to prescribe DoxyPep versus going to clinics that cater more to the black gay community here in Atlanta, where where they usually receive kind of like judgment and shame when trying to access DoxyPep. So it's like we're not learning, unfortunately, from the same mistakes that we made over a decade ago. Do either Jason want to chime in on that?
Yeah. So I think what a lot of, I mean, I think a lot of providers um, may sometimes have, um, they may sometimes have good intentions, but sometimes even the good intentions can still land differently for said person because you don't know what your client's lifestyle is or how they like to receive pleasure or what kinks or fetishes or what they prefer in the bedroom. So really, and also like Kevin said, you have to prescribing things, you have to let your client know that they do have a toolbox because that's how I learned. I learned that this is with in my prevention safety toolbox, and prevention and safety looks different for each and every person. It's not a one size fit all. It's not a one size fit all. Again, we can say, and y'all can say it to your face to turn blue, everybody need to wear a condom. But what I see in the real world in practice in like with just as someone that does frequent sex parties here and there, what I see in practice, not everybody wants to use a condom. I've put out condoms out at sex parties, and and everybody uses it, and that's okay, there's Even for some parties, they at least have the list of places you can go to get tested, treated, using HIV testing locator or the PrEP navigator PrEP navigator tool or so many other tools they have. And one of the things that someone hears about asking for PrEP is, oh, you still need to use a condom. What many people may hear is that, oh, I don't trust your decision. I don't trust your decision making, and it implies that PrEP alone isn't a legitimate prevention strategy, even though we know it's extraordinarily effective when taken as prescribed. And condoms still remain, an incredible option. And I encourage people to use it in their toolbox if they feel the need to, because one, depending on a person's goals, it could, condoms can be pregnancy prevention or protection from STIs, but also condoms should be prescribed as the prerequisite for deserving PrEP or as moral benchmark as for a good patient. People have fun for many reasons beyond reproduction. They have sex for intimacy, pleasure, exploration, stress relief. I definitely have for stress relief because I'd be stressed. um, Connection, affirmation, and joy. And if we are unwilling to acknowledge that pleasure is part of the way that people have sex, we're missing the point and the biggest opportunities to build trust. Harm reduction means meeting people where they're at, not where we wish them to be. If someone says they don't enjoy condoms isn't or not going to use it consistently, we shouldn't shame them. We help them by finding other prevention strategies that will help them that they will use consistently. That's how public health succeeds. So doxy PrEP. It is many different forms of PrEP. You can take it every day, or you can take it every 2 months, or you can take it every other 6 months. I'm on the 6 months one. That works out for me because I do struggle with depression, anxiety. I've had bouts of depression where I was not taking my medication every day.
Mhm.
Mm.
So being on the 6 months injectable for Yes2Go is life saving for me right now.
Mhm.
Literally. It takes the stress of having to pop a pill every day. So
No, that's very important. What me and you always have so much in common because I'm the friend that whenever my friends are throwing sex parties or like
yes.
when I used to work in the clinic, they were like, Michael, can you bring us like a bag of condoms? So yeah, that's another thing we have in common.
Yeah.
But thank you for sharing that and really talking about why options are important. And actually, I want to highlight a question from Wakefield in the chat that actually talks about
Mhm.
being able to have options. Hey Wakefield, he says there may also be differences in condom usage or willingness by age. For the panel, does this panel believe condom users need doxypep?
Yeah.
The condom can break. So
No,
Yeah.
oh, go
And
ahead.
no, no, I'll just mention too that, like, before someone goes into a provider room, they're coming with their full lived experience. So, us in the queer and trans communities, that, we have a lot of shame and stigma growing up as these identities already in our relationships with intimacy. So, we are coming with our full self. So when we do or do not choose to talk about our relationships to intimacy and sex, it obviously is already hard to talk about our prevention options, our treatment options. And that's why I firmly believe that PrEP and HIV care should be part of the primary care process rather than a separate way of care or pathway to care. And, when I think, as we discussed already, I think words and intentionality matter because when we say, people should be told to use condoms or told to, have different behavior methods in relationship to sex, we know how that can actually materialize to harmful policy. We have dated and racist and awful HIV criminalization laws that are based on this, that are based on, you know,
blaming people for how they behave. And we know that is does not work in a public health intervention. And now, especially in the age of, multiple prevention options, including long-acting injectables, oral PrEP, PrEP on demand, and then also, of course, you includes you, that there should be no bad policy or bad, um, even messaging about how we engage with impacted communities in PrEP.
Thank you. And I want to answer Wakefield's question. And we're being transparent and sex positive. That's what I put. That's what we put on the flyer. So I'm gonna have a transparent moment. No shame, no judgment. As someone who, for the first more than decade of being sexually active, because I was really, because I had my own issues with internalized stigma around HIV and STIs, I mostly lean towards being a side, oral only. And it wasn't until once I got on PrEP and got more comfortable being able to engage in penetrative sex without a condom. Um, Actually, first time getting an STI was oral gonorrhea. I'm like, a
Mm,
decade of like condomless oral sex, never got any STI. Then I finally start getting comfortable with like penetrative sex with no condom, and I got an oral STI, and I was just like, that. Yeah, I mean, it boggled my mind. So because of that experience, and now I, 10 years later, I've been on PrEP for 11 years now. If I have a fun night at the Eagle where even if it's oral only, I still take my doxypep. So,
Right.
to answer that question, I think it's all about choice and education and what we learn from our own lived experiences that help influence those choices. Some people may choose to only use doxypep if they are engaging in penetrative sex or condomless sex or oral only sex. It's up to you. It's and it's those conversations that you have to have with your provider to know, how to so you can have and make those decisions.
If I want to add something right quick, because you said something that really triggered something in my head. So like with our sexual health education system, which is trash and Basura, is not universal across all 50 states. Most states may not have a sex education class, sex ed class, or even a comprehensive sex education system that doesn't really exist. Plus, many people don't know how to wear a condom. First of all, they don't know how to put on a condom. They don't know that they most even with a condom, most people may only think like, oh, it's only for like penetrative uh anal or vaginal sex, which one of those one of those things, but they don't even but most folks may not even know that you can still catch something orally in your throat. And most people that I know, I'm just gonna use I statement. Most people I know or I had experience with, because I always ask these questions. When you are getting head, do you put on a condom?
I,
I just want to know. I just want to know. I just want to know because most people I know that wants to get
that
head.
that's the
no,
next question.
oh, go ahead.
That's the next poll question.
No, I'm gonna plug tomorrow is National HIV Testing Day. So good day to go and get tested tomorrow or anytime this weekend. But as somebody who has tested thousands of people over the course of my career and asking them questions about their sex lives, I could probably literally count on my hands how many people have told me they use condoms consistently during oral sex. We don't. I think it's just part of human nature. I think also because we have centered HIV around a lot of
Mhm.
sexual health when it comes to gay men. We don't sometimes um, talk about like other sexual health issues. So I think because we centered HIV for so long, oral sex has been seen as a risk reduction behavior. When it comes to the transmission of HIV. So people typically do not use condoms during oral sex. Sometimes they engage in oral sex because they want to reduce the risk of acquiring HIV. So, if they're not,
It's not going to reduce the risk of chlamydia, gonorrhea. Is not going to do that. So for me, I guess it's just like if we not using it for that, and that's what that consistency. A lot of people, they don't like again, going back to pleasure. A lot of people do not like they don't want to taste they don't want to taste latex in their mouth. They don't.
Right.
They want they want the skins. I'm not talking about the I'm talking about regular skin to mouth, whatever sort of pleasure from that. So why does that's acceptable to some people, or well, that's acceptable, but if someone wants to get no condoms raw dog on a Friday night or just any other day, why is that looked down upon? Because of stigma.
Well, I want to get to one more question before we open it up to Q&A because I want to give the everybody a chance to have any
Yes.
questions that they may have. So, this one, another area where we see stigma and shame with PrEP access, but not talked about as often, is with substance use and harm reduction.
Mm.
Jason Rosenberg, could you tell us what Callen-Lorde is doing to address stigma around harm reduction and tell us about the party and prevention kits?
Yeah, definitely. So, probably around like mid-April, I'm sure a lot of folks on the call are familiar with our recent Chief Medical Officer, Dr. Dimitri Daskalakis. But he came in with a brand new idea, but something that I know that he's done in previous capacities of, you know, really unapologetic interventions about PrEP use and just prevention at large. So we have introduced a Callen-Lorde for Pride, and then we'll probably extend it beyond Pride, is a party and prevention kit, as Michael mentioned. And in the kit, we have a user manual so that folks know how to use each of the pieces and items in the kit, but it includes an OraQuick at-home rapid HIV test. It includes 2 doses of PrEP on demand, 2 doses of doxypep, Narcan, fentanyl and xylene strips for people to test their drugs, um, lip balm, condoms, lube, hand sanitizer, sunscreen. So basically everything that someone could enjoy their Pride Month, but to do it in ways that they feel um, protected and safe, and whatever definition that is to them, to really feel autonomy with how they um, use a kit like this that really feels like, we're actually, I remember in 2012 when the FDA approved PrEP, and, even when we first started, our first meetings at PrEP for All, we said like what it would mean to actually remove every single chain or barrier that is involved with accessing this life-saving and revolutionary drug. And this is kind of what this intervention is about. It's about reaching impacted communities. It's about ensuring that every person has every toolbox available to them, and doing it in a really effective and fun way. I'll drop in the chat as well the video that we did to announce it. It was with Suzanne Barsh, who's a really vibrant and longtime veteran of the nightlife community in New York City and beyond. And we've been having a lot of fun with seeing and exploring ways that we could do outreach for it. So I'm going to drop the video in the chat.
Is the
Oh,
is the prep is the prep kits? I'm sorry, the prep kits. The kits, are they only in NYC, or can I get one here in DC? Because I want to know.
we're gonna explore kind of what this is a pilot, so we're gonna see what kind of next steps are. So right now, we've been offering it every Friday and Saturday in Pride Month, aside from Juneteenth. We're offering it today, actually, from 1 to 3 outside of our Chelsea clinic, and then also tomorrow at Youth Pride. So I think I would say the only like challenge that we have with providing these kits is that they do have medication. So we do need a certified physician or provider to hand out these kits. So we have kind of the admin level who's doing registration with folks. And then we also have someone who is on the side just asking patients if they have any allergens to either doxypep or PrEP on demand. If they say no, then they'll be given a kit. And we've been, in the messaging, we've been saying too that if you are someone um, living with HIV, that is fine. Take what you need. Um, and, this is really an intervention for anyone and everyone.
Thank you, Jason, for not just the comment, for the work that you guys are doing over at Callen-Lorde. That's just really people-centered work, and I really, really appreciate that. I see Jeremiah's hand is up. I just want to take one question from the chat and then get to Jeremiah.
Actually, it's just quickly related to
Okay.
Jason. I just want to give a quick teaser that Prep for All is working to partner with Callen-Lorde to educate other clinicians to see if this is an option in other places outside of New York City. So fingers crossed, more to come. Just wanted to provide that little bit of context.
Thank you, thank you. We're always collaborating, so trying to that's a great opportunity to kind of expand what Callen-Lorde is doing, and Prep for All is happy to facilitate that. There's a chat question in the chat. How do you explain PrEP on demand 211 and the use of doxypep to folks? I know the standard clinical verbiage, but just curious to see what other folks here utilize. Um, I'll answer, and if the panelists want to answer as well, I'll say. I've been sitting on this question because I saw it in the chat, so that's why I'm just like jumping to answer. Um, two things I do. I prefer to say 211 rather than on demand because it gives you the formula right there. Two, one, and one. Um, Also, one of the things that I've learned over the years is when I say stuff, because sometimes what we think is normal language is public health jargon. Um, and so I like to call and response. So after I explain something, I don't just ask the person, do you understand? I ask them to explain it back to me because most people won't, get it. Sometimes people get intimidated and won't tell a counselor, or a provider, oh, I don't know what that means. They'll just shake their heads. So I would say like, could you explain that back to me in your own words? Do you have any questions about what I said? Just to kind of, and that lets me know, okay, the way you're explaining it, if the last three patients haven't been able to explain it back to you, you need to rethink how you are explaining it because it's not landing. It's not being understood. So that's just one of the ways that I always make sure I'm explaining it in a way that resonates. Jason, did you want to jump in?
For the 211 method, for me, I think that you would have to really be good at scheduling super happy adult fun time. With that, because for me and my sex life, it's usually unpredictable. So I may get some, I may not get some sex. So that's why for me, I'm usually on the one that is either every day or long active release injections. But I do like that the 211 again, that is something that is out and available for people to utilize if you are very good at scheduling those things. And there, for DoxyPep, what was the question about? It was around the on demand DoxyPep. How do you explain to folks? So I guess for me, how I would explain it would be like, I usually tell people like, oh, so PrEP is kind of like birth control, but for HIV that you can take beforehand before you have sex, and if you need something that's a post exposure PrEP, post exposure prophylaxis, that is something that's the morning after pill, but you gotta take it within 72 hours. Same thing with post exposure doxypep, which is doxycycline uses post exposure prophylaxis. I explained that as like, oh, think of the morning after pill, but for STIs. And it protects against syphilis, chlamydia, and sometimes gonorrhea. That's just what it is. So that's how I explain it. That's how I do it. And then just talking about sex and sometimes with people that may have had a positive test result for gonorrhea, chlamydia, or may have some side they're feeling symptomatic. I just tell them, you just got the sexy flu. Let's go ahead and cure it so it doesn't become the sexy pneumonia. Because there are people already are on edge. They're already on edge. They're already like, oh, I didn't had a hot time this weekend, and they get to my office for me to test them, and they're like, oh, I just did a lot this weekend, and like I went to this party, had sex with three guys. I'm the one that's going to tell them like, well, did you have fun? You got yours. You did all the things. Congratulations. You know how to get three people in one day or one weekend. Not everybody can do that. So big sh-
No,
that's just me.
no,
That's just me.
I would always tell my clients when you know, you can kind of read body language and feel people clamming up. When
Yeah.
I feel them clamming up or getting shy, I always tell them, I promise you my stories are better than yours. I just can't tell you while I'm on. And it would just like burst out laughing, but that would just like open. I was like, I can't tell you the stories while I'm on the clock, but I promise
Right.
mine might be better than yours. So like, and
Right.
especially when you're like wearing like shirt and tie and dress professional, and they see you as a counselor, when your tone shifts, like, but sometimes you have to do what you have to do to get people to open up and share and be honest, build
Exactly.
trust with them.
Yeah,
Um,
'cause they'll be gagged when I ask them that they would be so gagged. They're like, oh well, I did have a fun time. That's all that matters. And you're here today, so kudos to you.
there's I see you answered it in the chat, but I'd like to get it on camera too, Jason. There's another question for Jason Rosenberg. Does the patient have to see a provider to get a kit, or do they have to schedule a follow-up with a provider to get a kit?
Yeah, I mean, this intervention of the partying prevention kit is meant to be the lowest barrier of engagement in healthcare. So, we have these hours of distribution, and all someone has to do, they don't even have to be a patient, is come up to one of the distribution hours, which are outside of our clinic. And they have to complete a short registration form. And we have a provider on site who is asking just a quick question about if there's any allergic reactions to the medications that are in the kit. And if not, then they receive the kit and they're on their merry way. They don't have to um, you know, have a follow-up appointment, or they don't have to have an appointment at all. The goal is really just to ensure that people have what they need in the quickest way possible.
Thank you. And Jason has a question for Jason in the chat. And then Kevin has his hand up after that. Jason Watler, do you want to ask your question?
Yeah, I asked if the kits were for everyone or for gay men because at times, like, just a lot of these things, especially we see them during Pride and everything, and it's just the whole like, are we making this available for are these kits are for everybody that can walk up, men, women, whomever they identify, or are we just prescribing this for mostly the queer male population?
No, this is for literally everyone. I think I would say the only caveat with that is I know that PrEP on demand was not, especially as generic Truvada, wasn't studied around, I believe, cisgender women. So we just have to be mindful about how we message that. But everything else, and I'll mention something I didn't say that was in the kit was Plan B on request. We're also putting that in the kit, which is a really holistic approach for every single person who wants this kit. Um, so no, this kit is for everyone. And as I mentioned too, part of the video was actually messaged by Suzanne Barsh, who is a cisgender woman. So this barrier to, I mean, this connection to healthcare is for everyone because everyone deserves it.
Awesome. Kevin, you had your hand up.
Yeah, I just wanted to jump in really quickly, just because, I'm somebody that has, navigated the world of being a sex worker and drug use and all of those things. And I just wanted to remind any healthcare providers in the room that your patients don't have to be sober for you to prescribe them PrEP. I I've seen so many people get kicked out of clinics because they walk in smelling like weed or they look like they're visibly intoxicated or the whole gambit. And I'm absolutely sick and tired of seeing that. I'm also absolutely sick and tired of seeing our LGBTQ centers and our HIV orgs allowing people to sleep outside on their front steps without ever offering people experiencing homelessness any support, any food, any health care, or any of those things. I see that so often, especially here in Dallas, especially here in Texas, where I see a lot of our queer community members not able to acquire the support they need because of the stigma they experience from the LGBTQ center themselves. Like we always have conversations about pointing the finger at people that are trying to oppress us, but we're also being oppressed from the inside. And so I just wanted to like highlight that really quickly because a lot of our queer community is dying out on the street because we're not doing the bare minimum and we're treating our community as if they are not worthy of receiving these healthcare services. And also, one last thing. If you're an organization handing out gift cards to get people on PrEP so that your program improves, please stop doing that. You're giving people false hope that they are able to acquire the resources that you're perpetuating that you give, and profiting off of it at the same time. I've watched that happen for many, many years. And the people that we're leaving in the shadows are the ones that are dying and the ones that are not being talked about at all. So in the whole scope of harm reduction, stop discriminating against your patients and actually hear them out and treat them like human beings because we're tired of it.
Most out of touch organization that I've ever worked for. Not Prep for All. I won't name names, but the most out of touch organization that I ever worked for sent us to the homeless center to do testing and give people $10 gift cards if they got tested. So embarrassing as a test counselor to even have to go out and do that. And it was just so out of touch. And it wasn't even fruitful. So it was embarrassing. It was shameful to the community that we serve. So thank you for sharing that. As we have a few minutes left, I would like to turn. Well, first, thank you all for participating. Everyone who joined us today and participated in the Mentimeter, everyone who watched on Facebook. Of course, our amazing speakers today who shared about their work and their experiences. Look forward to seeing them more as members of the PrEP Users Union. If you are a current or former member, a current or former PrEP user who are and you're interested in writing or being on video or participating in future webinars, join the Prep Users Union at prepforall.org/prep saves. And you can also watch some of our previous campaigns, and we have upcoming campaigns that I can't wait to share more information about as well. So thank you guys, and going to turn it over to Jeremiah.
Thanks, Michael. Going to be super brief. And I think in the future, when we have these conversations, we need to schedule them to be a little bit longer because I feel like we just got like the appetizer of the great conversation. So I don't want to detract from the rest of that. I will just say how refreshing to be able to talk candidly about stigma that's specifically related to HIV prevention. It's a little bit different than I experience as a person living with HIV, and I think it's specifically talking about bodily autonomy around and the right to choose your prevention methods is something that's really interesting and unique in the preventive space. And to be able to pair that with what Callen-Lorde is doing, which is really trying to eliminate those hurdles, those questions, those gates that you have to pass through to give the right answer before you're able to get access. I will just say, and okay, so I wasn't going to go on too long, and here I am. But my whole life have been frustrated because there is a sense of people in society over whom we get to have commentaries on their bodies and their sexual choice. And then there are other people in society that we don't get to do that. Queer communities, there is this sense that there could be public ownership of our choices, that we cannot be trusted to choose what is right for ourselves and for our communities. And I will just say, I welcome a time when we can have more of that autonomy and more of that respect for our communities. And one last thing I'll say on that is our communities do understand the circumstances in which we find ourselves. When Mpox came around, the reason why the rates started to go down, part was advocacy push to get vaccines out there. But a huge amount of that was that the community did change its behavior to protect each other. So we know what to do. You need to work with us. You need to trust us. Give us our options, and we will make decisions that work for ourselves and for our communities. So with that, I do want to just give two policy updates quickly for people to keep an eye on, because all of this relates to stigma. The reason why funding attacks happen to our HIV programs is because policymakers know that these issues are stigmatized and they know that they can go after them. And so, a big way that we fight back against stigma is we need to call them and let them know that these are issues that matter, that their constituents care about these issues. And so I'm going to put first one action alert that is with the Save HIV funding campaign, which PrEP for All co-promotes with AVAC and the HIV Medicine Association. Basically, they are trying to eliminate HIV prevention at the CDC. That's going to affect PrEP access. So if you go there, you can call that phone number and it will automatically take you to calls with your senators and your representative, and you can talk to them about the importance of PrEP, protecting CDC funding, protecting HIV funding in general, and making sure that we keep that infrastructure. So really encourage people to take the time to do that. The lovely voice of the lovely Max Boykin will introduce you when you call the number and walk you through some of the things that you can say. The other thing that I want to uplift for you is RFK Jr. He is extremely, extremely stigmatizing on these issues. And you may have heard that he is coming after a critical task force that protects insurance coverage for PrEP. And so we are on high alert around this right now. And this action alert from PrEP for All offers you the opportunity to send letters to your representative and senators on this to ask them to put guardrails and keep an eye on this task force and protect those coverage protections. So those are two things. We have many other policy updates, but we've ran out of time. So I'll leave it there. And again, just thank you everybody for being part of this conversation. And Jason and Kevin, you guys are just absolutely the best. Just really grateful to work with you.
Thank you, everyone. And again, this should be on our YouTube channel soon, and it's live streaming on Facebook. So if you want to rewatch any parts that you missed, you can go back on our Facebook and watch it as well. Thank you. And we will have another one coming up soon.
Bye, everyone.
Bye. Thank you for joining. Have a great rest of your weekend.
Happy Pride.
Bye, everyone.
Bye.
Happy Pride.
Great job, y'all.
Thank y'all for having us.